Okay, let's talk about something really important. Pediatric bradycardia. When a child's heart rate suddenly drops, every single second counts, and knowing the right steps to take in exactly the right order can change everything. So, let's get right into it.
So let me ask you this. Picture it. You're looking at a monitor, and you see a kid's heart rate just plummet. What's the first thing that jumps into your head? What's the failing system? You know, most people's minds go straight to the heart, but is that where we should be looking?
And here it is, maybe the most important thing you'll hear in this entire explainer. It's almost never a primary heart problem. The real culprit, the thing that's actually causing this whole crisis, is the breathing.
That's right. The real emergency here is almost always hypoxia, a lack of oxygen. See, a child's heart is an incredibly strong muscle. It's really resilient, but it absolutely depends on a constant supply of oxygen to do its job. So when a child can't breathe properly, their O2 levels just tank, and the heart slows way down in response. It's a survival mechanism. So we've got to shift our mindset, right? Away from cardiology and straight towards pulmonology.
Okay, so while hypoxia is always suspect number one, you know a good clinician never gets tunnel vision. If you've sorted out the airway, you've got them breathing, but that heart rate is still stubbornly low, well, it's time to put on our detective hats and start searching for other clues.
And this list really drives home how different kids are. You have to think about things like an accidental overdose, sometimes from just a single pill of a parent's medication. And for babies, you even have to consider intoxication from mom's breast milk. Then there are the other big ones, metabolic issues, like dangerously low blood sugar, severe dehydration, or of course, exposure to opioids.
All right, whatever the cause turns out to be, we need to know how the child is doing right now. So we know the heart rate is low, but are they perfusing? Is blood actually getting to their brain and organs? This little formula is a fantastic tool to use right at the bedside. The absolute minimum systolic blood pressure you want to see is 70 plus 2 times their age and years. It's a super fast, super essential check for shock.
So we've talked a lot about the why. Now let's get to the really critical part. What do you actually do? Managing pediatric bradycardia isn't just a mad dash to do everything at once. No way. It's a very clear step-by-step process. There's a hierarchy, and sticking to it is everything.
And here is that protocol. Step 1, and it is always step 1, is to fix the root problem. Get them oxygen and start ventilating. If you do that well, a lot of the time that heart rate will just pop right back up on its own. But if it doesn't, if that heart rate stays dangerously low, then you start chest compressions. And only after you've done those first 2 things do you even think about reaching for meds, with epinephrine being your first choice. So, let's get into those medications. When you do get to that point, there are really 2 main players on the field, epinephrine and atropine. But listen, they are not interchangeable, not at all. And in pediatrics, picking the right one first is absolutely crucial.
Let's make this simple. Epinephrine is your first choice. It is the go-to, primary, and safer drug for most kids with bradycardia who haven't responded to oxygen and compressions. Atropine is a second stringer. It's reserved for really specific scenarios like a true AV block, which is a problem with the heart's own electrical wiring, or the more common issue of increased vagal tone.
So what does increased vagal tone even mean in the real world? Well, it's basically an overstimulation of the vagus nerve, which acts like a brake on the heart. It can be triggered by stuff like suctioning too aggressively in the nose or throat, really bad coughing fits, or even things like sleep apnea and acid reflux. This is the very specific situation where you might start thinking about atropine. But, and this is a huge but, there is a major warning that comes with atropine. If you give too small of a dose, or if you push it too slowly, it can have a paradoxical effect. It can actually make the bradycardia worse. So the takeaway is critical. If you're going to use atropine, you have to use the right minimum dose and you have to push it fast. No messing around.
And that brings us to our final intervention, which is truly a last resort, transcutaneous pacing. Yeah, we're talking about putting the pads on and using electricity to stimulate the heart, but this is absolutely not something we do for every bradycardic kid.
Pacing is for a primary cardiac problem. We're talking about a real short circuit in the heart's electrical system, like a complete heart block or some other conduction issue that just hasn't responded to anything else we've thrown at it. It's also something you might consider in a child who you know has a pre-existing structural heart disease. This is a cardiology tool for a cardiology problem, period.
And honestly, this is just as important, knowing when not to pace.
You do not pace a heart that is slow because it's been starved of oxygen. It's like kicking a tired horse. It's not going to work, and you're just wasting precious, precious time. And pacing a heart that's already weak and damaged from a post-arrest injury is also totally ineffective. You can't shock a tired, oxygen-deprived muscle back to health.
So after all of that, if you just remember one single thing from this whole explainer, please let it be this. Treat the lungs to fix the heart. The fastest, most effective way to help a bradycardic child's heart is to focus all your attention on their breathing. Give them oxygen, support their ventilation, and in most cases, the heart will take care of itself.
So I'll leave you with this final thought. The next time those alarms are screaming and you see that slow heart rate on the monitor, what's your gut reaction going to be? Are you going to be fumbling for ECG leads to figure out the rhythm, or is your first immediate life-saving instinct going to be to grab that oxygen mask? The answer really does make all the difference in the world.